This week we are blessed to have a speaker tackling the issue of pain. Last week we dealt with it. Today we're going to deal with the relief of that pain. And maybe you're standing there or sitting there and watching from wherever you're watching from, and you have had a lot of pain, mild pain, severe pain, whatever form of pain, and you've been wondering, where do I take my pain? And perhaps you've gone to places looking for relief, but I can assure you, you are watching a show with a difference. Your life will never be the same again. And last time, if you remember, we had about something that fascinated me a lot. It's called the fascia. Fascia is that connecting tissue, the doctor told us, that holds and separates our organs and our muscles, stabilizes them very well. And if it's not working well, then we have problems. And today we're going to learn more. So my invitation to you, bring your questions. Let your friends know that you're on to a good thing and you don't fail to share this with somebody. So let me go ahead and invite our guest, Dr. Hamisi, to remind us who he is, so that in case you didn't watch last time, you want to know who is talking to you today. Dr. Hamisi, karibu sana. Please tell us who you are and where you come from.
Thank you so much, Reverend Maggie, for hosting me a second time. My name is Dr. Hamisi Kotayali, a chiropractor specialized in fascia manipulation by STECO. I've been practicing medicine for the last 21 years, but I've been in practice here in Kenya and my own practice for the last 8 years. I'm excited to be able to bring you another way of looking at the human body, another way at helping you relieve your pain, relieve your discomfort, relieve some of those things that bother you in a day-to-day living. Last week we talked about the fascia, and we talked about and said that this is the tissue that connects and interlinks our body from head to toe. Mm-hmm. And we talked about how when this tissue gets wrinkled, when this tissue gets twisted, it causes a strangulation of organs, of blood vessels, of muscles, of nerves to cause you pain. So today we're going to look at how do we examine it? How do we look at it? And then when we examine it, how then do we come up with a treatment strategy that is able then to help you relieve pain? Remember, the difference between us is that we practice more Eastern medicine versus the modern medicine that you're used to, or rather what we call school medicine. So I welcome you to the show. I hope you'll enjoy it. I hope I'll make a difference to you. I hope I'll give you something. I'll give you hope that then, should you be having a problem, you can have hope that there's another way that you can look at your problem.
Thank you so much. I think we want to start with some questions that came from the last show. Okay. And one of them is from James Jugona, who was watching, and he said he had a cyst removed from his lower point of his vertebrae through surgery. One question, could that cyst have been caused by a sitting position? In other words, does our sitting position affect us in one way or the other, and in which way? What do you recommend for chronic pain on cervical spine and neck area? Those are two questions. Can I ask that one?
Yes, can I ask that?
The third one. Does it mean that for every pain, routing or routing from bones does not necessarily need surgery?
Let me start with question number one. And to be able to answer question number one, I'll say that whenever in Eastern medicine, when we see a cyst, we don't see a cyst as pathology, because we have had research that has been able to prove to us that a cyst is not a pathology. However, in modern medicine, it's taken as a pathology. But let me explain then how do we not take it as a pathology. Let me use the female reproductive system. It's easy to explain because it's easy for one to understand. Assuming I'm a uterus and I have fallopian tubes on the side, we assume that I am inside someone. Okay? Mm-hmm. I'm inside someone. And on the outside, there's a wall, and there's a wall where these fallopian tubes are held on that side, and held on that side, and held in the front, and held at the back, so that this uterus then can be balanced in the center. Now, if there is an imbalance of whatever nature, and this uterus has to be pulled this way, the body will not allow the uterus to be crooked like this. So it will create something here, a cyst. It will create a cyst here to pull this way to balance. So the cyst that will form here, like a fibroid, will be not a pathology, but a counterbalance. Because as I said last time, the body organs needs to have an area of play, an area of free movement. Whenever this area of free movement is affected, then a cyst is created to try and prepare space and create space. Like what I was saying, so if the uterus is pulled this way, a cyst will create here to try and pull this way, to balance. Okay? Same in this case of a patient who sits for long. The cyst can create in the spine because maybe if he sits for long and is bending all the time and it's causing a lot of tension on one side of the body and the nerves are being pressed, the body will try to create a cyst to try and push that nerve to the side, to try to create space for the nerve to move, and as a result, that cyst will be there. So, but the cyst itself is not in our looking a pathology, but a body, a way of trying to help itself. Yes. And then you talked about the second question for the neck pain.
The second question is the
Neck pain.
Neck pain and cervical pain.
Yes. Today, a lot of people are suffering from neck pain, majorly because of occupation. We are working 8 hours jobs a day. So you get to your office, you sit behind a computer, you work on the computer, and as you get tired, you follow the computer, and you keep on bending down. So over time, we are developing this type of posture. So we are hunched forward, shoulders are rotated forward, and our head is kind of looking up, and our back is forced to go back. So as a result of this change in posture, we create a lot of tension. A lot of tension on the muscles of the back. Why? Because the muscles of the back are trying so hard to hold the neck, the head. The head is about 12 kilos.
A whole 12 kg?
It's about 12 kilos of our head, if you measure our head. So it's supposed to be balanced like that. So every time the head moves an inch forward or a centimeter forward, the body has to be supporting 10 newtons or 10, like a kilo of weight from falling. So that constant pressure over time, it makes the muscles to go rigid, and when they go rigid, they stiffen up, and that stiffening up gives us that pain that we always want to keep on pressing. And if you notice is that you get very hard muscles on the neck and hard at the back. That is what causes all that stiffness. How do we treat it? We treat it by doing the reverse, to release the tension. If you're already tight like this, you're overstretched at the back. We don't work at the back. If you work at the back, you're not helping. You need to work from the front to open up the chest back. And you also need to be given exercises that are going to remove you from here
to the normal.
Yes, so we say patients to do what we call chin tuck exercise. You pull your neck back. It's a chin tuck exercise. You're pulling your neck back so that you correct the curve. Otherwise, when you take an X-ray or take an MRI, it will show a lot of muscle spasm around the neck. And also, if it's there for so long, it will show a lot of degenerative change on the neck, which is diagnosed as cervical spondylosis.
Wow. And then the pelvic pain?
If you're having a pelvic pain on the same, and it's the same thing, what happens is that if you sit for so long, we shorten these muscles here because of sitting for so long. There's a muscle here called the psoas. This muscle is what makes us be able to move our legs. So for sitting for so long in the seat, maybe you sit in the car, you go to the work, you sit in the office, you get up from the car, you sit again, you go home. So these muscles shortens, and when they shorten, they tilt the pelvis forward, causing these muscles to be overstretched. So this one becomes tight, but this becomes short. As a result of that, yes. This becomes tight, this becomes short. When this becomes short, then the pelvis is twisted like that. Then you end up having a lot of pressure on the back, on the nerves at the back. And as a result of prolonged use like this, then you start getting degenerative change that will cause compression of the nerve as they exit to go into supply the legs and other internal organs.